Hi, my name is Kate O'Donnell. I am a student nurse with Cedar Crest College, and today I am going to talk to you about the research topic that I chose. So the PICO question that was addressed is, what is the effectiveness of kangaroo care in preterm infants in a NICU setting or a neonatal intensive care unit compared to not using kangaroo care for invasive procedures, specifically heel sticks? So the purpose of this research project was to address how kangaroo care, which is also known as skin-to-skin contact, when the mother holds her preterm infant in between her bare breasts in the prone position. This assists with comfort, bonding, and it doesn't necessarily have to be with the mother. It can also be done with the father as well. So the three research articles that I chose to back up my information on kangaroo care and diminishing pain responses in preterm infants in the NICU tested two different things while doing this research. One was kangaroo care compared to standard care, such as receiving the care or the invasive procedure in an incubator. So all three research articles looked at, it's called the Premature Pain Infant Profile, or PIP, P-I-P-P, to address the pain score in a preterm infant. As we all know, preterm infants cannot verbally tell you that hurts or that's uncomfortable. So this PIP score tells you the heart rate. They evaluate the heart rate, blood pressure, oxygen saturation, and also visual cues such as grimacing and crying. Along with the PIP score, the studies also looked at how the salivary and serum cortisol levels were affected during invasive procedures. So at baseline, normal cortisol levels were recorded, and then with invasive procedures such as heel sticks to collect blood, cortisol levels would show an increase and during painful procedures. So during this research study, it showed that kangaroo care during invasive procedures such as heel sticks actually lowered PIP scores. So the heart rates were stable, vital signs were stable such as respirations, oxygen saturation, heart rate, and blood pressure. There was less grimacing, crying, and overall the preterm infant seemed more comfortable during the procedures as compared to in the incubator when the invasive procedures would be done. So during the time in the incubator when heel sticks were performed and no kangaroo care was done to the preterm infant, the PIP scores were significantly increased, heart rates were elevated, blood pressures elevated. They were overusing their oxygen with crying, so their oxygen levels would drop. So this just shows that kangaroo care overall has been a great intervention in preventing long-term effects on infants. It's also showed that when these preterm infants are exposed to all these painful procedures, it's been shown that they can have blood draws up to 10 to 16 times a day just because they're being so closely monitored. And it has been shown that long-term effects and pain responses later on in life can be affected. So it's good to control the pain response in the preterm infants now. So looking at this overall presentation or this overall research study, many NICUs or neonatal intensive care units across the country have been implementing kangaroo care in the NICU, not just during invasive procedures, but also during, they really try and support the parents, not just the mother, but the mother and the father in doing kangaroo care for that bonding experience as well. It gives that child and the parents that level of comfort that's needed. And because there's so many painful interventions such as heel sticks and blood draws, whether the child needs to be suctioned or has IV lines on them, the kangaroo care really helps to diminish their overall response to these painful procedures. It's recommended that kangaroo care will be used in the NICU setting to assist with these infants and really help them to overall developmentally grow as well, because kangaroo care has been shown to developmentally assist these preterm infants that are in the NICU setting. It's implementing this into the NICU. It's important that staff who work in that setting are trained properly and can be advocates for these new parents. people don't walk into pregnancy knowing that they're going to deliver a preterm baby. So implementing this education is key for staff and for new parents. So overall, this PICO question addressed that kangaroo care is an effective intervention. It's not costly, and it's a great way to assist these preterm infants in diminishing their pain responses and affecting their vital signs. So thank you.